Welcome to the Simulated ABR software program. Today we're going to be doing through a walkthrough of the program on the many various options and features that it provides. To start, let's load up the program. After clicking on the sABR icon, password requirement is needed, and you will have to enter the password provided by your distributor. Once entering the correct password, you will end a screen that asks you to enter the patient's initials. In this case, we'll enter AH, click OK, and the sABR program will load up, and you can see some various options that we'll walk through. The sABR program has many different features. It starts up with loading up a patient, initials AH, that we just entered. It randomly selects an age. In this case, we are selecting for infants, so it's a 1.5-month-old infant. It also selects a behavioral audiogram, in this case, an audiogram of an infant with a hearing loss. It will also select, if we wish, to simulate a hearing impairment with auditory neuropathy spectrum disorder. It'll give a certain percentage. And that audiogram is shown down here in the right as a plot of the audiogram with the air and bone conducted thresholds. In addition, there are ABR wave delays. This is for retrocochlear losses, in which it will simulate different delays for the different waves, 1, 2, 3, 4, 5. And there's a 1 to 3 interval and a 1 to 5, and it simulates and lets you know the percent of retrocochlear loss. So we can go ahead and simulate any type of hearing impairment we wish. Classify this as normal. We click on the normal button, and we can see that the audiogram thresholds are showing within normal limits. And you can see that visually in the plot down here on the right. We can also simulate a conductive hearing loss, CHL, and you can see that we have elevated air thresholds and normal bone conducted thresholds. We can also simulate a sensory neural hearing loss, which shows, in this case, elevated air and bone thresholds for both left and right. And these will come at many different configurations, randomly selected. If you just keep on clicking on that button, you'll see various different sensory neural hearing loss configurations. We can also simulate auditory neuropathy spectrum disorder. Select that, and obviously there is some hearing loss in this condition, and if you look up to the percent ANSD, we have 30%, 94% across the different ears. We can also simulate retrocochlear losses. Click on the button retrocochlear, and in this case you can see the asymmetrical loss in which some patients generally have. The left ear has normal hearing thresholds, and the right has elevated thresholds with almost a flat loss. And you can note that in the left ear, there are no delays of the waveforms for peaks 1, 2, 3, 4, 5, and no interpeak delays of 1 to 3 or 1 to 5. But for the right ear, there is a retrocochlear involvement, and there are delays in all of the ABR waves, and you can note that the 1 to 5 interval has an increased delay of 1.83 milliseconds. So that's added on top of the normal distribution for this population. We're going to go to a normal hearing threshold simulation and run some ABR simulations on this. Up here there's a button that says Show Audiogram. We can click that and it'll hide the audiogram, hide and show the audiogram. And behind that page we have the acquire page. But before we get started recording some simulated ABRs, we need to know what some of these other buttons are doing. At the top of the page, we'll have clear left page, clear right ear page, and clear all plots on this. Above the acquire page, we have the file name, in which will correspond to the file that we're recording or have selected, the frequency in which the stimulus was presented, the stim rate at which it was presented, the number of sweeps, the signal to noise ratio interval, and it'll provide values for the signal to noise ratio and the residual noise levels. Just below that, here are the filter settings that we have during recording. We have different pages. There's a drop-down menu, acquire, page 1, all the way to page 20. So that's for offline plotting. When we're recording, it will automatically resort back to the acquire page. You then have the ability to save those pages. Below that, we'll see in this box here, file names for each of the waveforms that we generate. We can plot them, we can select a few of them, do some averaging, subtraction, multiplication, and what we call split buffers. We can also select on those and delete them, and we'll see that in a moment. This button down here, if we select it, shows the ongoing EEG. And now in this case, it's a fairly noisy EEG with a lot of fluctuations. And to the right of that, we have our rejection limits. Currently, these are not set in the current program, but it gives you an idea of what you can do to set when you get rejections. The line turns red, and when it doesn't exceed the rejection limits, it maintains a green color. Below that, we have our noise parameters. We can set our noise, the amount of noise in which we want to simulate. To start, the program starts off with a noise gain of 2, arbitrarily set. And if we just click on this slider, we can see that the noise in the EEG is getting larger and larger in amplitude. And we can set that to whatever value we want. The slider goes up to 10. But if you even want 100 gain, you can do 100 gain. For our purposes, we're going to go back to a setting of 2.0. In this, we can also, for demonstration purposes and for learning purposes, we can include our 60 Hertz line noise. Now you can see that there's a 60 Hertz oscillation going on here. We can also add a high frequency noise, which sometimes occurs for electrode popping or when the impedance isn't set properly. And you can include both if you like. For our purposes, we're going to turn those two off and look at some of the other features we have over on the left. On the bottom left, we have the stimulus and recording parameters. We have an acquire function that will acquire each ABR. We have a button which we can say record online, and I'll demonstrate that in a moment. A clamped run, which means it's like clamping the tube where no stimulus energy is presented, but the stimulus artifact remains. During our recording, we can click this stop button and stop our recordings. We have the stimulus intensity, right now set at 30 dB normal hearing level, NHL. We can select our frequency from a drop-down menu, 500, 1000, 2000, and 4000 Hertz. We can also do rare click stimuli and condensation click stimuli. We can present them as air conducted or bone conducted. Select whatever rate we wish. In this case, we're doing infant tone ABR, so the rate is at 39 Hertz. Select which ear we want to stimulate. The channels to record, if it's ipsilateral channel, contralateral channel, or both. We can also change the number of sweeps to whatever we desire, but in this case, our protocol dictates that we set at 2,000 sweeps. We can also add in contralateral masking and simulate contralateral masking, and this becomes important when we have very large asymmetrical losses. Okay, so let's get to recording a 30 decibel NHL 2000 Hertz tone, air conducted, presented at a rate of 39 per second or 39 Hertz, presented at the left ear, recording the ipsilateral channel and recording 2000 sweeps. We go here and click Acquire, and you'll see the waveforms come up as ongoing sweeps and averaging occurs. At the top here we have our sweeps as they're accumulating in the average, and you can see the change in the signal to noise ratio, SNR 1 in this case, and residual noise declining with the increase in averaging of the sweeps. We'll let that record through up to 2,000 sweeps. Then I will show you the option of speeding this up a bit and clicking the online off button, and it will automatically record the waveform. Okay, now we've recorded one replication of that 2000 Hertz ABR. I'm going to speed this up and show you the option of turning off the online recording. You hit Acquire, and a second replication automatically appears.